Okay, I've got just a couple of minutes after, so I want to welcome everyone. Thank you for joining us for today's webinar. My name is Laura Moore, and I'm the Director of Clinical Professional Services here at Philips. Today we are presenting Remote Monitoring of Isolation Patients, hosted by Ray McLean. Just a little housekeeping before we get started. The webinar is being recorded, and a link will be provided shortly after the webinar for you to review. Please use the Q&A button at the bottom of your screen to submit any questions. The questions will be collected and sent as an FAQ to all attendees. Our presenter today is Ray McLean. Ray is a workflow thought leader for Philips. As a thought leader, Ray is responsible for leading customers to vision the possibilities in the what could be state and builds roadmaps and service offerings to help them get there. He uses his expertise of Philips monitoring products and capabilities in consideration of options for solving customer challenges in workflow optimization, and he's currently heavily focused in the telemetry care area. Ray is a certified Kaizen leader and has developed and implemented telemetry optimization projects with a focus on change management. Ray is a veteran of the U.S. Air Force and served in Desert Shield, Desert Storm prior to starting his medical career. He has over 28 years of experience, currently as a registered nurse, and started out as an EMT paramedic working in EMS and disaster management, and then as a flight paramedic. He also was the Injury Prevention and Outreach Coordinator for the University of Rochester's Regional Level 1 Trauma Center prior to starting his career at Philips. Ray is currently enrolled in a Master's of Data Science program at Utica College and will graduate this August of 2020. As a data scientist, he will help organizations leverage social data for better problem solving and will build analytical models to improve both patient and economical outcomes. Ray has presented nationally, speaking on topics such as injury prevention, workflow, and data in healthcare. Now, without further ado, we will turn the time over to Ray.
Thank you, Laura. I appreciate the introduction. It's great to be speaking with all of you today. Before we dive into the webinar, it is my honor to introduce two subject matter experts that will be speaking to solutions that may help with monitoring of isolation patients. Next slide. Sara Michaela is a registered nurse with 15 years of diverse clinical nursing experience. She started her career as an ER trauma nurse in Michigan and California, then advanced to become a flight nurse, transporting critically ill patients internationally. She worked occupational medicine at J.P. Morgan Chase in New York City and Chicago with a focus on creating new employee health programs. She has been with Philips Healthcare for over 5 years, starting as a product application specialist, delivering direct customer support, along with the installation, education, and support of patient monitoring solutions. Currently, Sara is a lead pre-sales clinical consultant for patient monitoring in the Midwest. She utilizes her clinical knowledge and product expertise to serve as a customer advocate. She specializes in evaluating current workflow and state of monitoring to determine appropriate solutions. Sara is also a mentor to new hires and assists in providing solution selling and product training to the sales team. She received an MVP Sales Award in 2019 for her contribution to the Midwest team. Sara graduated from Southwest Michigan College with an ADN in nursing, and in 2005, then completed her BSN from Chamberlain University. Pete Stribling is a registered nurse with 35 years experience in cardiac and critical care nursing. Prior to joining Philips, he was a unit-based educational facilitator responsible for the orientation, education, and development of staff in the CCU. As a clinical nurse specialist for cardiovascular services, his role expanded and included supporting and guiding staff in the delivery of patient and family care. In addition, he was responsible for developing and implementing policies, processes, and procedures for cardiovascular services. Pete has been with HP Agilent Philips for 21 years as a clinical application specialist. In this role, he worked directly with customers during implementations to assess needs, configure monitoring systems, planning, education and go-live activities, and deliver clinical services. Currently, in this role as a national CS, Pete is heavily involved with new product introduction, clinical readiness, new higher education and preparation, and clinical services implementations. Pete obtained his BSN degree in 1983 from the University of Mississippi School of Nursing. He obtained his Master's of Science in Nursing in 1990, also from the University of Mississippi. Please join me in welcoming Sara and Pete to this webinar. I want to start this webinar with a brief video focused on the challenges in patient care and how monitoring solutions might assist.
What patient care challenges do you face today? Are you looking to simplify life for a clinical staff stretched to the limit? Remove complexity as a barrier to faster decision-making? Reduce variability in care delivery? Integrate emerging technologies with your IT systems and EMR? No matter what your challenges, they all revolve around your ability to watch over your patients and provide the best care possible wherever it takes place. Philips Patient Monitoring is more than a network of bedside and mobile devices strung together and connected to a central station. It's an integrated solution that fits securely into your hospital's IT environment to help drive clinical and economic outcomes. It captures a steady stream of patient data from monitors and medical devices, then feeds it automatically to your EMR for virtually gap-free patient records from admission to discharge, even during transport. Philips Patient Monitoring Solution taps the power of advanced clinical decision support tools to help you detect the onset of critical events like sepsis and pneumonia, so clinicians can make informed care decisions. And it gives on-the-move caregivers virtually anywhere, anytime visibility to a patient's vital signs, waveforms, and alarms, so they can communicate and collaborate to decide on the best course of care and the right caregiver to provide it. Philips bedside, transport, and mobile monitors all share the same interface to reduce complexity, minimize training, and support the consistent delivery of quality care at every level of acuity. Plus, this comprehensive patient monitoring solution works with your current IT system to help you make the most of your investment, while risk-based, defense in-depth security helps protect the privacy of patients and integrity of data. Philips works with you right from the start and at every stage of ownership to help you customize and standardize your patient monitoring solution to your hospital, your protocols, and your people. Philips Patient Monitoring is a total solution designed around your challenges and backed by ongoing consulting, training, service, and support to help you achieve your clinical and economic goals, so you can confidently deliver quality care everywhere it matters. At Philips, there is always a way to make life better. Innovation and you, Philips.
The objectives we will cover in this webinar are a review of workflow considerations in the context of people, processes, and technology, a review of the basics of monitoring, sharing some information around remote monitoring solutions, and a live demonstration on how the XDS solution might assist with remote monitoring. Workflow can help to streamline tasks, mitigate errors, and increase efficiency. Healthcare teams can deliver better care as processes and technologies help overcome patient care challenges. In order to achieve optimization, we should look at how these three pillars of people, process, and technology affect each other. When people and processes overlap without technology, there's organization without efficiency. When processes and technology overlap without people, there's lack of insight. For the last overlap, here's where we find ourselves in monitoring isolation patients in this crisis. When people and technology overlap without process, there is danger and safety risk for both patients and providers. We need all three pillars to get to the heart of optimization and improve outcomes. In a moment, we'll introduce a few solutions that may help overcome challenges of monitoring patients in isolation. Before we start talking about solutions, we should talk about the basics of patient monitoring. So Pete, what can we do as clinicians to maximize the potential of technology solutions to impact patient care?
Hi, Ray. Well, technology and solutions are very exciting and can definitely have a positive impact on patient care and clinical workflow. But, the last time I checked, technology is not a human caregiver. What technological solutions can give to us is only as good as what we give to the technology. We have to keep in mind the fundamentals of patient monitoring, such as good skin prep, accurate electrode placement, proper SpO2 sensor and non-invasive blood pressure cuff selection and application. Now, these are just a few of the basic but very essential things that we can do to make sure the information we get from technological solutions is accurate and meaningful.
Thanks, Pete. As I mentioned, there are many challenges healthcare teams face when patients are in isolation. Specifically, in units that require many patient interactions like an ICU. These added workflows create inefficiencies in our process. Clinicians have to change workflows in order to mitigate spread of infection. In this illustration, as you all can see, solutions like an EICU, central monitoring units, PIC-IX central stations, mobile care assist, clinical decision support tools, and XDS are all ways to reduce exposure patterns. As a reminder, these are Philips solutions that may or may not be in existence in your current setting. Similar solutions may also be available from other vendors. Sara, would you mind sharing some insight on these solutions?
Yes, Ray. And again, thank you so much for having me today. So let's start with the EICU concept. When I think about not only the surge capacity demands, but also the increase in the number of isolation patients that we're caring for today, an EICU model is particularly beneficial. And here's a few reasons why I would say so. Number one, having another pair of eyes on my patient. In the traditional ICU setup, physicians and nurses walk from room to room, tending to the needs of their patients, just like we're used to doing on a regular basis. But just imagine now if your patients were also under the care of an EICU. The virtual clinician in the EICU is able to come to work each day, sit at his or her workstation, and immediately pull up the patient census for who they're caring for, and within just seconds, able to identify and recognize the sickest patients under their care and the ones the team really needs to focus on first. The EICU clinical team utilizes powerful analytical tools to monitor a patient's condition and intervene proactively. This concept is truly to partner together with the on-site staff to provide the best care and outcomes for your patients. I also think about not only keeping our patients hemodynamically stable, but also the mental health of these patients being treated in isolation that are all alone. Just imagine the patients that are there that really, they're not on vents or they're not heavily sedated. The fear of being alone is just unimaginable to think about. With an EICU, the virtual clinician has access to not only visually see the patient, but they also can communicate with them via bidirectional audio and video. To me, what a sense of relief and assurance these patients would feel knowing that they not only have their bedside staff available to them, but they also have virtual clinicians who are monitoring them around the clock. The additional care that can be provided to the isolation patients, as well as the assistance to the bedside clinicians, makes an EICU solution very ideal. And Ray, again, by providing this additional care for our patients remotely, it's going to markedly reduce the number of times that the bedside clinician needs to don PPE to go in and out of the room. To me, as a nurse, perfect concept.
Interesting stuff on the EICU for sure, Sara. I'm curious, are there any other solutions that may already be in place in these units with isolation patients?
Well, of course, Ray, there are. Today, it's actually part of my job as a clinical sales consultant to be sure that my customers are aware and understand the technology they have access to and to optimize it to its full potential. Those of you that have Philips patient monitoring may or may not know that you're able to interact with the bedside monitor from your central station. The important thing to remember with this concept is that your central station may or may not be configured to allow this. You may ask, why would it not be configured to allow me to interact with my bedside monitor? Well, think about when we weren't caring for so many isolation patients. Policies and procedures really wanted us to provide care such as silencing our alarms and changing alarm limits at the bedside while assessing our patients. Well, when we're thinking about the current pandemic and are caring for multiple isolation patients at once, it would make sense to allow more interaction to occur remotely and at a central station, including managing your alarms, possibly taking a blood pressure, and even maybe changing the blood pressure interval time. Besides interacting with the bedside monitor, also remember there are many tools that are available at the central station that give visual indicators of change in your patient's condition. Now, my friend Pete's going to go into more detail and actually show us what some of these tools look like. However, I just wanted to be clear that these tools are not only available at your bedside monitor, but also at the central stations. A few of the tools include your ST maps, which if you're a Philips customer, you probably know what the ST map is. It allows the visual interpretation of ST segments. We also have QT analysis to continuously monitor our QTs for prolongation, and also early warning scoring, which is going to aggregate the patient's vital signs to identify early deterioration. Now also, think about the other devices that are connected to our patients in isolation, such as ventilators. So the vent data is visualized in the patient's room on the display, and it may or may not be integrated to the EMR via numerous different types of solutions that are available. But what about the alarms that are going off? Where are they audible? Are they going off in the room for only the patient to hear? Do I have to enter the room every time I need to interact with the ventilator and maybe silence alarm or make vent change settings or changes to my vent settings? It's nice to know that your devices such as ventilators can be integrated to the patient monitor to allow data and alarms to be viewed at the central station, as well as sending that data out to mobile devices. Wouldn't it be ideal for not only nurses to view this data at a central station, but also receive mobile alerts in regards to their ventilator? And also, let's not forget about our respiratory therapists to receive this information. It can go to them as well. So again, Ray, super important to optimize the use of technology available when caring for the isolation patients to improve your patient workflows and ultimately to improve your patient care.
Sara, it seems as if caregivers are needing to see similar data or the same data. When outside of the unit, is there a way to bring this information to their mobile devices?
Yes, sir. So Philips has two applications that are available for smartphones to put the patient monitoring information directly at their fingertips. And there's other vendors out there that do similar concepts as well. The first application that Philips offers is Mobile Caregiver, which provides the caregiver access to virtual views of a central station. Now with this tool, the clinicians are able to access their patient's data on the go. Again, another powerful tool to have while caring for isolation patients when resources are scarce and workloads are full. Also, besides viewing that central station information, another consideration when we're caring for isolation patients is mobile alerting. Wouldn't it be nice to not only receive the alert from your patient monitor on your phone, but also to have the capability to review that alarm strip? With the Philips Care Assist application, the clinician receives an alert to their smartphone that will include waveforms and parameters around that alarm. Not only does it allow you to see the clinical context around that actual alert, but you're also able to toggle back and forth to view the near real-time monitoring data. So for example, I may receive an alert that my patient is in VTAC. What I'm able to do is I can look at my phone, look at that VTAC, but then I can also toggle right over to another application to see, is my patient still in VTAC just a few seconds later, or have they converted out? With that clinical context at my fingertips, you're able to assess the alarm and the rhythm, and then also prioritize your response. This has huge positive impacts to efficient clinical care that can occur outside the room. This type of alerting also has the capability to be configured to follow an escalation path. Another super important concept when caring for multiple isolation patients. So if I'm in a room taking care of an isolation patient and I receive an alert on another patient of mine, I can feel confident that if I do not acknowledge that alert in a specified period of time, it will be escalated onto another caregiver. So today, especially, Ray, caregivers are always on the move, managing multiple patients, responding to multiple alerts, meeting with clinical teams, and documenting their care. Yet no matter where they are, they can feel confident they'll receive the information in regards to their patients to give the proper care, especially those isolation patients.
Sarah, the mobile phone applications are fantastic. However, we understand that you may not have access to mobile devices, let alone smartphones. So let's discuss another option of monitoring your patients remotely. Pete, what are your thoughts on this?
Well, Ray, Sarah had mentioned one of the solutions that's available, and that is XDS. XDS is an application that runs on a PC outside the patient's room that connects to the patient monitoring system. It has several uses in the clinical area, but one of the more common ones is to provide a second display that allows you to control the monitor remotely, say outside the isolation room, in addition to seeing the patient's data. With the current pandemic creating a potential shortage of PPE, this allows for safe operation of the patient monitor without having to utilize PPE to simply interact with the monitor, to change something on the monitor. It also allows for the clinician to interact with all of their assigned patients through XDS in one area, such as an alcove or in a central viewing area. This also can save PPE, but also saves time going from bed to bed, to silence alarms, to check on the monitor, or to interact with the monitor. Some of the other common interactions that clinicians can utilize with XDS are for silencing the alarms, which I've mentioned, changing alarm parameters, and I'll show you some of these things in just a moment, starting non-invasive blood pressure, bringing up trend data, and all those types of things right outside the patient's room.
So tell me about the remote control feature. Does this mean I can change things on a monitor like alarm settings? What about silencing alarms?
Sure. And that's a good question. I have XDS actually running on my laptop here in my office. It's connected to a monitor just several feet away. And I just brought it up so everyone could see the actual XDS screen that I'm going to be interacting with. Remote control is exactly what it sounds like. XDS allows you to control remotely using your mouse to click on the XDS screen on different portions of it, just like you would at the bedside monitor. So you can adjust or change or manage most of the settings on the monitor. You can also use different monitor applications. We'll talk about some of the clinical decision support tools. Again, executed or manipulated remotely from the XDS. So as an example, if I wanted to change the heart rate alarm settings, I would just simply roll my mouse over the 60, which is the heart rate. You click on it, it opens up the menu. This is no different than if you were at the bedside, adjusting those alarm settings. Come over to whichever setting you wanted to change. So in this case, it's the height of it. Let's say I wanted to pull that down from 150 to 140. You can see it changes it in the menu, as well as it changes it, you can see in the alarm settings beside the heart rate. Similarly, if I needed to adjust my SpO2 alarm settings, clicking on that brings up the same menu that we saw just a moment ago. Clicking on the low limit as an example, bringing it down to 88, closing the window. So that's simply how you could go in and make adjustments to the alarm settings or some of the parameter settings. Another function or thing that you can do with XDS without having to go into the room, let's say you needed to initiate a non-invasive blood pressure. So we have a smart key down here that says Start NBP. You would simply click on that, and with the good fundamental practice of having the cuff on, the cuff sized appropriately, that would start a non-invasive blood pressure from outside the room if you needed to get one in between your cycles. let's say that this patient has been chilled out. We don't need to have blood pressure cycling as frequently as every 15 minutes. You can click on the numeric itself, the non-invasive numeric. It brings up the setup menu, and then I can go in and change. Say, was it 30 minutes, and I could change it to cycle every hour. So it's the same functionality that you could perform at the bedside, okay? And then once I'm done with that, I can go back to main screen to close all of those windows out.
Interesting. Pete, in regards to alarms, are alarms enunciated through XDS? Can you hear the alarms at the XDS display?
Well, Ray, that also is a good question. What we need to keep in mind is that XDS is not a primary alarming device. It does not generate alarms. XDS gets the waveforms, the numerics, the data from the bedside monitor. The bedside monitor is the primary alarming device as well as the central station. However, with XDS, the alarm indicators, which would be the alarm banners with the information in the banners, the blinking numerics and so forth that we see at the bedside, are displayed on XDS outside the patient room. So if you are there outside the patient's room and there's an alarm going on in the room at the monitor, you can see exactly what it is. It's happening on XDS, and then you can address it if you needed to acknowledge it outside the room, make adjustments to the alarm settings, and those types of things. So yes, you can silence, but since it is not an alarming device, you're not going to hear those tones.
I like the idea of having a display outside of a room. Is the second display showing what is on a monitor in a room, or can I change what I want to see?
Well, the short answer is both. What we're looking at here is pretty much a standard display, which you may see on virtually all of the monitors at the bedside. It's got 6 waves. We see our numerics and so forth. But yes, you can change on XDS how the data, how the numerics and the waveforms are being displayed, okay? So, for instance, what we're looking at here, as I mentioned, is 6 waves. We have numerics over here to the right-hand side. And let's say we have that patient that comes in, and me having a background of cardiology, I'm going to use some cardiology examples. We have that patient that comes in that is post-cardiac intervention, stent placement, let's say, and you are monitoring for occlusion, re-occlusion. So one of the things that you can do with XDS is change the screen. So I roll my mouse up here to the upper right-hand corner where the screen name is, pulls up a list of screens that are in XDS. Many of the same screens would be in the bedside monitor, but I want to see it outside the room. So by clicking on STE, it changes the screen, and now we have a graphical representation of one of our clinical decision support tools, and this is ST elevation monitoring. In this example, we could be using one of our 12-lead applications, whether it's easy or hexad or conventional 12-lead with 10 electrodes. And what we would be showing on the monitor here in the middle are these 2 maps, which are graphically trending ST segment elevation with the gray areas in here that you see are the critical, the alarm areas based on clinical trials, okay? So we are seeing the information very graphic, simple graphic. If the blob gets bigger, that means there's more deviation in the ST segments, okay? So let's say we're getting this information. We start to have, the patient starts to have ST segment elevation, gets in towards those critical areas. And what we want to see then is the 12-lead. Remember, one of the tools that we would be using is the one of our 12-lead applications, easy hexad or potentially the 10 electrode 12-lead. So coming back, can come back up here to the screen name, clicking on that, then I could go to the 12-lead screen. And so what I'm doing, again, outside the patient's room, pulling up the data that I need. So now I am seeing all 12 leads go across the monitor. I still have my ST map over here. I still have my other numerics, including my non-invasive pressure. So now we can see what's happening real time with the patient. And Because we got all of this meaningful and useful information, protocols got started, actions were taken, issues were resolved, and the patient improved. Good job, guys. Good job.
Thanks, Pete. I just have one more question. With the current coronavirus pandemic, several drugs and/or drug combinations are showing promise as potential effective treatments. It is recognized that many of these drugs do have the potential to cause QT interval prolongation, and this has elevated continuous QT monitoring as a necessary measurement. Can XDS assist the clinician with assessing QT status outside of the patient room?
Absolutely, Ray. As you may have already noticed on the screens, the QT interval algorithm is running. But what I would like to do is change to a different screen that I have in XDS. It also could be in the monitor. So it comes back to your question, Ray. Does it have to look like the bedside or different? And the short answer was both. So what I'm going to do is, again, change the screen. And I am going to go to a screen that has what's called horizon trends. So before I get to that, is one of our clinical decision support tools, let's talk a little bit about what our QT monitoring application is. It's a continuous measurement of the patient's QT interval. And not only that, is by monitoring or measuring the QT interval, we also apply a rate correction factor so that we get what's called the QTC, the rate corrected QT interval, which is actually a much better clinical measurement than just the direct QT. In addition to the QTC, we also generate what's called a delta QTC. What the delta QTC is the difference between baseline when we've started monitoring the patient's QT or when we reset the baseline to what is the current QTC. So just by looking at a single number without looking at anything else, if this QTC began to go up, that's telling me that the QT interval is beginning to prolong. So we would be able to see that, again, without having to do calculations. Remember what the QTC was an hour ago. In addition to the numerics, we also have showing up on the screen down here what are called horizon trends. So again, this is one of our clinical decision support tools. It's available for many different measurements, but in this case, we're looking at it in terms of monitoring QT. So what we would see here is a trend. This is the QTC as measured QT, and then the rate corrected, and then a delta QTC. So what I'm able to see here is if those values are stable and they're not changing, the arrow is horizontal. If those values, let's say that delta QTC began to go up, not only would we see the numeric value going up, but we would see the arrows starting to trend up, which is telling us that over a defined amount of time, we're seeing this amount of change in the QTC because it's prolonging. If the QTC was prolonged and then we were giving the patient treatments, we would see just the opposite. The delta QTC would be coming down and the arrow would be trending down. So again, very visual clinical decision support tools that were brought outside the room, going through different displays. So hopefully you can see that XDS is a solution that clinicians could use outside the room, making the determination, do I need to go into the room, disturbing the patient, donning PPE, or can I get the information that I need to make the decision I need to? So I hope that was clear, and I hope that it got some good information out.
Well, a lot of information. Thank you, Pete. I can't thank you and Sara enough. To everybody on this webinar, I hope you found some potential solutions that may solve the challenges your healthcare teams are facing when caring for patients in isolation. As a reminder, these are Philips solutions that may or may not be in existence in your current setting. Similar solutions may also be available from other vendors. If you think these solutions can improve your workflow process, our team is here to help you be successful. If you have any questions or truly do not know where to start, please contact me. I'll be happy to help you find a workflow solution. And finally, thank you, everyone. We appreciate you being here. If you have asked any questions during this webinar, your question will be answered and will be placed on an FAQ that will be distributed to you all. We at Philips are here for you during these unprecedented times. Would like to invite you to our global webpage should you have any further questions on how Philips is responding to COVID-19. Thanks again for joining us today, and we'll see you next time.
Thank you.
Thank you. Be safe.